Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. Dharmakshetre Kurukshetre, NEETPG in another 36 hours. So remember, when we go to a battle, we need to go with defiance to defeat and to be magnanimous with the victory. Never with the fear, but with the audacity to expect what is going to come and to attack what has come. That should be your attitude to become the topper. Every time we go for entrance, we feel, "Array, another 1 month would have been there, I would have been better. Another 15 days extra time I would have got, it would have been better." It's a common feeling for everybody, but the life gives very little opportunity in terms of time. Between mass, length, and time, time is the most invincible dimension that the physics has ever discovered. So, Pooja and many more who are all online, thank you for joining this session. Yeah, I know you're all in a revision mode, and I am here to feed you with the feast of high yield facts. So every sprint ebook PDF, we have around 1000 high yield facts. Totally 10 sprint ebook PDFs are there. Sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So in this 10 sprint ebook PDFs on learnograph.com, we have covered almost 10,000 PYQs from 2012 NEETPG to 2023 NEETPG. Each MCQ converted into a PYQ and classified which topic it belongs, so that it gives you a cursorial review what to focus based upon what the examiner asked in the past 10 years of question bank. So chalo, shuru karenge. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Please give a feedback. So once you go to the learnograph.com, you download the PDF, then you get the list of topics. Basically, Sprint 13 has all NEETPG 2013 13 questions. Those days they used to give around 1,500 questions basically, right? So can you please punch? Is the voice loud and clear for all? So these are the topics into which the 1000 PYQs have been classified. Then starts your PYQs. Can the online students can punch? So you have the serial number, the year when it is asked, and what is the topic it is, and what is the high yield fact that MCQ was based on, right? So Dr. Shreya, very good. Loud and clear, sir. Very good. JJ Singh, Pooja and everybody, all our old comrades who are ready to go in a disruptive energy to fight the battle of NEETPG in the next 36 hours. Now, swelling in the back midline, 1-day-old male delivered by LSCS. Swelling over the back in the midline is basically a neural tube defect, which is common in folic acid deficiency. Hyoid lies at which level? So it should be sure on the anatomical level, C3. Which nerve runs along with the profunda brachii artery in the spiral groove radial nerve? This reason spiral groove in the lower humerus is also called the radial groove. Axillary nerve is accompanied by posterior circumflex humeral artery. Interosseous membrane in the forearm is pierced by anterior interosseous artery. In the ankle, you are having flexor retinaculum, extensor retinaculum. What structure passes deep to flexor retinaculum, doctor? Posterior tibial artery. The femoral head, mainly, what is the blood supply? Profunda femoris. And The head and neck of femur, medial circumflex femoral artery. Superficial external pudendal artery, which supplies the genitalia, is a branch of the femoral artery. If you draw a line from the midinguinal point to adductor tubercle, what is it the surface marking of? It is the surface marking of the femoral artery. Upper two posterior intercostal arteries, they arise from the superior intercostal artery. Anterior intercostal artery is a branch of the internal thoracic artery. It's also called internal mammary artery. Some of you are going to become top cardiothoracic surgeons doing sternotomy every day as a CTVS surgeons. Dream for that moment, doctor. You should only positively dream. Nobody will stop you to dream to become big and great. And first you should believe yourself, then the whole world will believe you. Aberrant obturator artery, it arises from the inferior epigastric artery. Helicine artery is a branch of the deep artery of penis. Lateral surface of cerebral hemisphere, the main artery is the middle cerebral artery. The two vertebral arteries join to form the basilar artery. Basilar artery divides into posterior cerebral artery. Similarly, in the anterior circulation, internal carotid artery gives rise to middle cerebral artery, anterior cerebral artery. Then from the vertebral arteries and the basilar artery arise the pica. What is pica? Anterior inferior cerebral artery, posterior inferior cerebral artery. Pica is the one which supplies the lateral part of the medulla, is what you need to remember. So all these things, doctor, circle of Willis, one MCQ definitely will come. Basal cell carcinoma, most commonly from where? Lower medial part of the eyelid. What is the most common site for carcinoid tumor? Ileum. Most common pulmonary tumor in children? Carcinoid. What is commando operation? Whenever you are doing an excision of the carcinoma of the tongue, the floor of the mouth, the part of the jaw, and the lymph nodes en bloc, you call commando. What is the commonest site where the carcinoma of the tongue arises? Lateral borders. Cardiac muscle fibers, they form a syncytium. They have a large central nucleus. So you need to know what are all the tributaries of the cavernous sinus, what is the dangerous area on the face, how is it draining the cavernous sinus, what are the boundaries and what are the cranial nerves along the boundaries of the cavernous sinus. Everything you should know. Cavernous sinus is a favorite topic of the examiner. So while you are attending this session, doctor, all these sprint sessions, sit with one pen and paper. Observe the pattern. What are the pattern examiner is asking? You see, one question on artery out of 200 questions, inevitable. One question from brachial plexus, radial nerve, median nerve, ulnar nerve, musculocutaneous nerve, axillary nerve. Erb's palsy, Klumpke's palsy. Without that, there is no paper. Like that, you should have your own dream 500 topics from which 200 questions may, almost 190 are going to come. That is the power of the previous year questions. Previous questions are not meant to mug the line to line and expect them to get reproduced. No. Previous year questions will give you what to focus, what to put on your plate. Actual repetition, ditto, same question is hardly around not more than 10-20%. But there will be a different aspect about the radial nerve. If the Froment sign was asked once, right? Pen test will be asked in something else. If the radial nerve injury is asked, right? Then nerve supply of the lumbricals will be asked in the next exam. So you should know what to expect in the exam hall. Suddenly in the exam hall, oh my God, kind of feeling you are getting means you didn't prepare. You didn't finish PYQs at least one round. You have to finish. If you finish 10,000 PYQs, don't mug, don't ratta maro, batti maro, sab chhod do. Just go through 10,000 PYQs sitting with 2 to 3 ordinary, not extraordinary friends, ordinary, below ordinary friends. But sit and finish in about 100 hours these 10,000 PYQs. एक पावर आ जाएगा आपको, एक विजडम शुरू हो जाएगा, एक अवेयरनेस आएगा अंदर से, एक डिफरेंट टाइप ऑफ कॉन्फिडेंस मिल जाएगा. Don't try to solve the PYQs. Just go through the sprint ebooks. We converted already into single liners and then added which topic they belong to give you a bird's eye view. That's more than enough. Right, doctor? So once you know the game, okay, it's inevitable. So many times brachial plexus is asked in the last 10 years. I need to read. पहला श्रद्धा भक्ति आएगा उस टॉपिक के ऊपर. जब श्रद्धा और भक्ति आएगा उस टॉपिक को फोकस करना बोल के, ऑटोमेटिकली विदाउट एनीबडी पुशिंग यू विल फिनिश ऑल द हाई फैक्ट्स अबाउट दैट पर्टिकुलर टॉपिक. That is the secret of winning, doctor, in a very physiological way. So, chromosome 22 deletion, DiGeorge syndrome. So all components of DiGeorge, so many times you have seen DiGeorge can come. You know, Avil tablet, it's called phenylpropanol-amine. So it can lead to hemorrhagic stroke. Whenever there is any retrocardiac, behind the heart, lucency with air fluid level, then what is your diagnosis of such a radiogram? Hiatus hernia. So today only go back and see retrocardiac lucency with air fluid level or hiatus hernia X-ray, which is going to come in the tomorrow's exam. In DVT, it is a Doppler, which is the investigation of choice. Whenever elbow dislocation is there, one of the late complications is myositis ossificans. Spinal cord develops from neural tube. Collecting part of the kidney develops from ureteric bud. Arch of aorta develops from left fourth aortic arch artery is what you need to emphatically remember. Aortic arch derivatives is a favorite MCQ in the exam. Different types of epiphysis, traction epiphysis, atavistic epiphysis, everything you should know. Mastoid is a type of traction epiphysis. In the urinary bladder, transitional epithelium is the type of epithelium which is characteristic. So once more, it is one list. Every damn Dishkum study material will tell you list of epithelial linings of various structures, where you find stratified squamous, keratinized, non-keratinized, ciliary, columnar, everything you should know. Urinary bladder is transitional. Chorda tympani is the part of the middle ear. Chorda tympani will pass through middle ear. Stapedius is supplied by facial nerve. S for second branchial arch, S for stapedius, S for seventh nerve. You need to remember for the tomorrow's exam. Whatever, just now a group of 10 classmates have purchased Sprint 13 PDF from learnograph.com and joined this session. Very good, doctor. Yeah. So the whole purpose is to simplify the preparation. Preparation is not at all complicated, provided 10,000 PYQs को 100 घंटा बैठ के मुरली भरद्वाज के साथ और 3-4 क्लासमेट्स भी होना है. मैं तो आपका पेरिनियल क्लासमेट हूं, राइट? So we all sit together and crush these 10,000 high yield facts from these 10 sprint PYQ books, ebooks, right? And get ready for the exam. Fraze syndrome. It is a post-traumatic nerve fibers of the facial nerve with parasympathetic of auriculotemporal nerve. leading to reinnervation in parotid surgery is called Frey's syndrome. Glucagon stimulates gluconeogenesis. Alanine and lactate both can serve as a substrate for gluconeogenesis. Today only, please go, doctor, and revise what are glucogenic, ketogenic, purely ketogenic amino acids, etc., etc. Branching enzyme is found in glycogenesis. What is the main enzyme for glycogen metabolism? Glycogen synthase. Once more, what are all the allosteric regulators of the rate limiting enzymes of these pathways? You should be ready. The reducing equivalents which are produced in the cytosol from glycolysis, how are they transported to mitochondria? It is with the help of malate shunt. So you should be very sure, glycerophosphate shuttle, malate shuttle, you need to be very sure about. What is the allosteric activator of the phosphofructokinase 1? It is the fructose 2,6-bisphosphate, which is the enzyme of glycolysis that is also the part of gluconeogenesis. Phosphoglycerate kinase is what you should remember, which is a reversible step in the glycolysis. Inhibition of the glycolysis by increased supply of oxygen. When you have more oxygen, glycolysis is inhibited, which is called Pasteur effect. What is the method of reduction in inguinal hernia? It's called taxis. Raltegravir, once more, every NEETPG exam, doctor. Every NEETPG exam, at least 3 MCQs will be there from HIV. You will listen my words in the exam hall. Every NEETPG exam is not for 200 marks, doctor. It is 197 only because 3 questions come from HIV. Out of these 3, 1 question will be from HIV. Drugs agar nahi hai to mera naam Murli Bharadwaj nahi. So if you have not revised heart, highly active antiretroviral therapy, what are nucleoside, non-nucleoside, what are integrase inhibitors, everything, then we are not doing a great preparation. Like that, you should have 500 topics my ek martaba review करके एग्जाम को जाऊंगा बोल के एक 500 लिस्ट रख के फटाफट कंपल्सरी लिस्ट को रिवीजन करना. Understand? So nice to see Dr. K.T. Patel, Sai Kiran, Pooja, JJ Singh, Shreya, everybody. Please don't forget to like this video, share this video in all your social media groups like Telegram, Instagram, Anygram, wherever you are. And also please write comments after the video is over, to write comments below. More the comments, the YouTube will populate it virally, right? Syed, Asrar and many more. Good, doctor. So that is very important. You need to make that list and then do the last moment revision. Bole to wahi hai. Okay? Now, raltegravir cause hyperkalemia. So there was one hyperkalemia ECG which is being shown with the peak T waves image based question. That was that of hyperkalemia. One ECG will come, doctor. हम कब का बात कर रहे हैं? 2013 NEETPG में दिया. So since then every NEETPG entrance में एक question will come. One question will come on ECG of hypocalcemia, hypokalemia, hyperkalemia, hypercalcemia. You should be sure. Tetany is seen in hypocalcemia. Patient is on furosemide. ECG show U wave. Typically, it is hypokalemia. Implantation occurs 5 to 7 days of fertilization. Yesterday, we discussed at blastocyst stage. Blastocyst stage. That is when implantation occurs. Gallen's anastomosis is between recurrent laryngeal and internal laryngeal nerve. Once more, Dr. Bana, the favorite question. What are all the vocal cord muscles? Vocal cord muscles and their nerve supply. What is the sensory supply above the level of the vocal cords, below the level of the vocal cords? All these things you should be ready. Bilateral recurrent laryngeal nerve palsy. Where do you see that? Aortic aneurysm. Nerve supply of the larynx above the level of the vocal cord. अभी आ गया, अभी बोल रहे, अभी आ गया. Superior laryngeal nerve. Inlet of the larynx is formed by epiglottic fold. Which part of the larynx is involved in TB, doctor? Posterior larynx is more involved in TB. What is that spinal pathway that regulates the fine motor activity? Rubrospinal tract. If the rubrospinal tract is affected, that lead to tremor, which is called rubral tremor. What is meant by pyramidal tract? Corticospinal tract. From the pyramidal cells of beds, corticospinal tract descends down through the internal capsule and reaches the lower part of the medulla. At the level of the lower part of medulla, it degrades to the opposite side and reaches the Anderhorn cells and controls the contralateral Anderhorn cells. इसको कहते हैं pyramidal. Extra pyramidal क्या होता है? This is pyramidal. Extra pyramidal is, please repeat with me, 4 tracts. Rubrospinal, reticulospinal, vestibulospinal, rubrospinal, reticulospinal, tectospinal, vestibulospinal. These are all the pathways which also control the Anderhorn cells in addition to pyramidal tract, which is corticospinal. All this vestibulospinal, rubrospinal, tectospinal, reticulospinal, these are called extrapyramidal. If extrapyramidal tract is injured, then you get a increased tone and both the flexors, extensors are affected and there is a rigidity which is resistance throughout the motion. That's called rigidity, which is the feature of extrapyramidal. Whereas pyramidal tract lesion may, typically there will be only initial resistance, after that there is a giving up. Because extrapyramidal, the pyramidal tract, that is a corticospinal tract, does not affect the flexors and extensors equally. That's the reason initially only resistance, after that giving up. It's called clasp knife type of resistance in case of pyramidal tract lesion is what you need to remember. So what are the extrapyramidal tracts? Rubrospinal, reticulospinal, tectospinal, vestibulospinal. You need to be very, very sure, doctor. Right? Khelte pad sakte. Very nice to see Kirti. Thank you, Kirti, for writing very good comments after the video is over. Right? Not only in chat window, but also after the video is over. So once you write more and more comments below the video, YouTube gets inquisitive. It will start making the video become more viral. That's how we want the video to reach more number of people organically. So, doctor, precentral gyrus and corticospinal tract are important for voluntary movement. Oropharynx lymphatic drainage will go to jugulo-digastric node. Diffuse large B-cell lymphoma is the most common subtype of NHL in India. Don't forget. Nerve supply of the nail bed of the index finger comes from median nerve. Nerve supply of the muscles of the flexor compartment of the arm is musculocutaneous nerve. So these are all the pearls. Examiner diye hue Hyderabadi pearls that you need to master. Reflexly you should answer in the exam. Most common site of distant metastasis in intraorbital malignant melanoma kahan jayega? Liver ko jayega. How do you treat malignant melanoma? Wide excision. Multiple myeloma mein we see 11-14 translocation. Very nice to see 22 online classmates. Very good. Just now Around a group of 6 students have downloaded the Sprint 13 PDF ebook from the learnograph.com, where all these 1000 PYQs now I am discussing are basically from the PDF, which is now available on the learnograph.com. Myelodysplastic syndrome, just like cervical dysplasia precedes cervical cancer, myelodysplasia precedes the myeloid leukemia. It's very common in the age group more than 50 years. So how do you diagnose myelodysplastic syndrome? You should know the story. A patient, 54-year-old Pullaya, who is a farmer, comes to you. He has got a megaloblastic anemia. Somebody thought it is vitamin B12 deficiency. In primary health center, they have given 5 injections of vitamin B12. Still the MCV remains high and he is having anemia, megaloblastic anemia. So any refractory megaloblastic anemia in somebody, in spite of giving vitamin B12 therapy, should push you to do the bone marrow biopsy, karyotype. That is how you discover myelodysplastic syndrome, is what you need to basically remember. So doctor, pseudo-Pelger-Hute cells, where do you see? In myelodysplastic syndrome. Saddle nose is a depressed nose. Both the direct and consensual light reflex is absent in oculomotor nerve palsy. Because oculomotor's parasympathetic fibers supply the sphincter pupillae. If that is paralyzed, then there will be a fixed dilatation of the pupil. The roof of the olfactory region is formed by cribriform plate of ethmoid. What are the structures passing through superior orbital and inferior orbital fissure, doctor? All the skull and foramina. What are the contents of the skull foramina? Favorite question. Foramen rotundum, maxillary nerve will be passing, right? So, superior orbital fissure, oculomotor nerve, trochlear nerve, and superior ophthalmic vein will be passing. The longest part of the optic nerve is always intraorbital. Extraintestinal manifestations of the inflammatory bowel disease. So, there are some questions which are accept-based questions. While converting them into single liners, there was a little error. So in the 16th PYQ book, we will be adding all the none of the above, all of the above, except false, incorrect statement type of questions, image-based questions, everything in the last 16th sprint ebook, doctor. Now, pharyngeal muscles are derived from third pharyngeal arch. What is the muscle of third arch? Stylopharyngeus. In pancreatitis, there is a fat necrosis. Balthazar scoring system, you should know. Acute pancreatitis is one of the favorite hot topics for the examiner. What is the complication of chronic pancreatitis? You should know all the list. The CT severity index in acute pancreatitis is Balthazar. Endoscopic ultrasound criteria. When do you call chronic pancreatitis? Whenever echogenic lesions more than 3 mm are there, then you call chronic pancreatitis. Passavant's ridge is formed by palatopharyngeus. It is the pineal gland which forms the posterior wall of the third ventricle. Battledore placenta is when placenta is attached to the center. The most commonly used approach for brachial plexus block is supraclavicular to see the sella turcica, to know the pituitary gland. Rees view is the one which is used. Supraorbital fissures are better seen with Calvel's view. Portal vein supplies the liver. Portal vein is formed by mesenteric vein and splenic vein. Pubococcygeus is the support of the pancreas, of the prostate. Now, whenever radial nerve injury is there in spiral groove, extensor carpi radialis longus is paralyzed. Tetracycline injection can cause palsy of radial nerve. Injury to posterior interosseous nerve, which is the branch of the radial, typically results in inability to extend the metacarpophalangeal nerve joint. Referred ear pain may travel through abducens. Most common cause of the retropharyngeal absence in adults is tuberculosis. Which arthritis? There is no periosteal reaction, rheumatoid arthritis. Which arthritis is called non-erosive arthritis on radiograph, SLE. In SLE, you don't find erosions. Erosions are the feature of rheumatoid arthritis. Most common type of shoulder dislocation is preglenoid, not infraglenoid or supraglenoid. Preglenoid. Human sperm remains fertile. It will wait for the लैला के लिए मजनू वेट करेगा 24 to 48 hours. Spermiogenesis is the formation of the spermatozoa from the spermatids. Spermatogenesis, where will it occur? Seminiferous tubules. Morphologically defective sperms are called tetrazoospermia. Whenever you are doing nerve conduction study, the most common nerve used is tibial nerve in H reflex. Tonsillar fossa anteriorly is bound by palatoglossal fold. The most common cause of acute tonsillitis is beta hemolytic streptococci. So also for the quinsy, peritonsillar abscess by beta hemolytic streptococci. The most common nerve injured whenever there is any fracture of the medial epicondyle of the humerus is ulnar nerve. What is the drug of choice for intermediate uveitis, doctor? Systemic steroid. Red keratic precipitates are a feature of hemorrhagic uveitis. Mutton fat keratic precipitates are a feature of granulomatous uveitis. Snow banking effect is seen in intermediate uveitis, is what you need to remember. Whenever there are cells in the anterior chamber, hyphema, whenever cells are there in the anterior chamber, it is an indicator of anterior uveitis. Unilateral glaucoma with mild anterior uveitis is called Posner-Schlossman syndrome. How do you get inferior, double inferior vena cava? When there is a persistence of both the supracardinal and subcardinal veins, you get double inferior vena cava. Prevertebral space thickness कितना होता है? 7 mm to 22 mm. Block vertebrae are seen in the short-necked Klippel field syndrome. Picture frame vertebrae are the feature of Paget's disease. First carpal bone to appear is capitate. Cervical somites are the ones which are initially formed. The retina is an outgrowth of diencephalon. Hyaline cartilage में cartilage, 2 means type 2 collagen will be there. Billroth spots are there in red pulp. B cells are dispersed in white pulp of the spleen. Follicles are present in the cortex of lymph nodes. So, spleen, lymph node, thymus, tonsil, histology. Favorite topic of the examiner doctor. Favorite topic. Devendra Mansoori and many more who are all online. Kaushik Adhikari, Syed Asrar and everybody. Good doctor, good. Pubic symphysis is secondary cartilaginous joint. Thoracodorsal nerve root value is C6, C7, C8. Radial is the largest branch of the brachial plexus. The distal end of the humerus develops from 4 centers. Radial bursa is the synovial sheath which is covering the tendon of flexor carpi radialis. Which muscle originate from the tendon of the other muscles, doctor? Lumbricals. Lumbricals क्या करेगा? Flexion of the metacarpophalangeal joint and extension of the interphalangeal joint is the function of lumbricals. The muscle which cause supination of the forearm whenever the elbow is flexed is biceps brachii, which is supplied by musculocutaneous. The muscle causing supination of the forearm when the elbow is extended is the supinator muscle, which is supplied by radial nerve, is what you have to emphatically remember for the tomorrow's exam. Third extensor compartment of the wrist. It contains the tendon of extensor carpi radialis brevis. Can the online students can punch? Is the voice loud and clear for all of you? Yeah. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Yes. Now, true statement about great saphenous vein. It begins at the lateral end of the dorsal venous arch. The neurovascular bundle of the anterior compartment of the leg, it passes between extensor hallucis longus and EDL. Which muscle is called triceps surae? Gastrosoleus is called triceps surae. Thank you, Kirti, for the feedback. Now, linea aspera continues as gluteal tuberosity. Lateral surface of greater trochanter को attach होने वाला muscle क्या होता है? Gluteus medius. Sacrotuberous ligament is pierced by posterior cutaneous nerve. The skin and fascia of the great toe drains into the superficial inguinal lymph node. So remember, doctor, great toe is supplied by L5. Little toe is supplied by S1. Don't forget this innervation. 1 छोटा होता है little toe. 5 बड़ा होता है big toe. Big toe supplied by L5, little toe by S1. One of the favorite MCQs of the examiner. Now, doctor. Lower end of the femur is ossified by one ossification center. The muscle causing the flexion of the hip is psoas major. Sacral promontory is the landmark for the termination of the presacral nerve. Esophagus is posterior mediastinal component. Whenever the left atrium enlarges, it is most posterior chamber of the heart. Whenever mitral stenosis is there, left atrial enlargement is there, it will go and compress the esophagus and lead to dysphagia. Mediastinal part of the right lung, it is related to superior vena cava. Posterior surface of the heart is formed by LA, and most anterior part of the heart is right ventricle. It is antero-superior sternal part of the heart. Immediately behind the sternum is the right ventricle, is what you need to remember. So immediately posterior sternum, what is there? बोल examiner पूछे तो right ventricle. What is the most posterior chamber? पीछे क्या है? हमारे हाथ के पीछे क्या है? Left atrium. Left atrium is most posterior. Carina is situated at the level of T4. Upper vagina and cervix drains into external iliac lymph node. The surgeon removes a part of the liver to the left of the falciform ligament. It is Covenant's segment 2 and segment 3 is what you need to remember. So take it as my word, doctor, if you look at the last 5 to 6 question papers of NEETPG. Covenant's classification, caudate lobe is which Covenant segment. Everything about Covenant's classification is very, very important. Pooja is asking, sir, what will be the sprint content tomorrow? Definitely 2023, 200 questions we will try to iron out once. And the very common questions which are most expected from the top 500 topics, we will try to revise as many as possible. That is the hope. All right, doctor. So please do come for tomorrow's sprint as much you are comfortable. I thought of doing a overnight, midnight masala session, but that's not good. Early to bed, early to rise, do a little jogging, little yoga, and then pray God, take the blessings of daddy and mummy, and then go for the exam. You will automatically crack great. What you need to carry to the exam hall? Not the knowledge, not the high yield facts, not the apps, videos, mnemonics, last moment revision schedules, nothing. You need to carry अंधविश्वास अपने आप के ऊपर विश्वास होना चाहिए. When 2 million people, 2.5 million people contested for the NEET UG, you are a handful of top 10,000, 20,000, 30,000 people who got into medical college. Maybe 1 lakh seats are there. You are one among them. Already you have proven your mettle. You need not tell the world brilliant too many times. Right? You are already praised by your own patients that Dr. Amma, Dr. Saab, आप इतना अच्छा है, इतना अच्छा देखभाल करते हो, इतना मिठास बात करते हो, भगवान आपको सुख रहे. Already patients blessed you when you are in your internship. So you are born like Dalai Lama, you are born with a purpose in life. Like a monk, like a Buddhist monk, you are born with a purpose. Only prayer you need to give the God is, God, you created me to serve all those mycobacterium tuberculosis you are giving people. All the malignancies people, cells are giving them. You made me to become a great pediatrician to treat a febrile child when mother is anxiously waiting. You are here to treat me a pain in the chest with ST elevation emergently by doing a primary PTCA. God, you created me for that. So please give me the strength to use the best of my common sense to answer the question paper. Similar prayer to the parents is, they have brought us into this world with a purpose to see you become great, right? So the happiest thing always when I listen is when I hear great about my kid played great football, when one of my students has become MCH and doing great neurosurgeries. I feel great. So always parents look for that, right? So in this simple, short life God has given us, we need not complicate by unnecessary comparisons, unnecessary guilt. No guilt. Guilt, have you seen a dog feeling guilt? Have you seen a cat feeling guilt? No. Guilt is an artificial emotion only human beings feel. अरे मैं जरा अच्छा पढ़ा हो तो बेटर होगा, और जरा अच्छा पढ़े तो अच्छा होगा. Maybe I would have been great to my girlfriend. Maybe I would have not hurt her. All this guilt, artificial feeling. Waste. Life is not worth to feel guilt, feel remorse, feel anxious, feel overthink about the outcomes. No need. Just go and attack with simple common sense. That should be the prayer, doctor. And every day, as a doctor, we do the same thing. Do you think we treat, right now I'm having one patient called Uma Kapoor. She has breast carcinoma. Stage 4, PET scan showed multiple metastases. She had a huge decubitus ulcer, very deep on the back, covering both the buttocks, gluteal areas. We have done a grafting, we have given painkillers, we have done many things, and 3 times I admitted her and pulled her out. Once more, fourth time, she got admitted about 48 hours ago. She is in completely altered sensorium, sodium normal. It is not metabolic encephalopathy. Then we suspected probably she is having any metastasis to the brain. Then we found, except for a thickening of the meninges, most likely to be because of infective meningitis. We can't even do lumbar puncture, so bad is her condition. She has 5 daughters. So all the 5 sitting and crying. So what can I do as a clinician? I can only give my arm for somebody to cry and wet my shirt, right? So we are becoming doctors to carry on our shoulders a bigger misery in the hearts of the patients. So that is the reason we should not feel miserable while preparing for that great mission in life of becoming postgraduates, residents, consultants, and going to be top surgeons and physicians of tomorrow. So keep that in mind, doctor, and have confidence in heart and go without fear, audaciously, and take the battle on you and come back as a winner. Don't worry about what will be the outcome. So, doctor, Covenant's classification, definitely one question is going to come. Right testis is little higher. Internal spermatic fascia comes from fascia transversalis. Ratio of connective tissue to smooth muscle in cervix is 8:1. Pelvic pain is mediated by autonomic nerves. Cochleate uterus is acute anti-flexion. Anal canal is 35 to 40 mm length. Most common congenital anomaly of the kidney is horseshoe kidney. Superior wall of the middle ear is formed by tegmen tympani. Whenever you are winking, it is the orbicularis oculi is what you need to remember. Any deep injury of the neck always involves platysma. Lacrimal punctum of the upper and lower eyelids are opposed. The number of muscles in the middle ear is 2, tensor tympani and stapedius. Medulla oblongata arise from rhombencephalon. Glomus cells are chemoreceptors. Adiponectin is the one which prevents the obesity. Guardian angel against the obesity. Adiponectin. NEETPG 2013 ka question. Once more, ghrelins, adiponectins, you need to be very sure. What is the minimum fluid urine output for neutral solute balance? At least 500 ml, below which you call oliguria. Type 3 respiratory failure, where do you see? Type 1 means hypoxia with normocapnia. Type 2 is hypoxia with hypercapnia. Type 3 means post-operatively, when there is an atelectasis, you call type 3 respiratory failure. Normal vital capacity in an adult is 4,700 ml. And once more, doctor, all the lung volumes, last moment revision may, one MCQ will come on the lung volumes. That's the reason, just go back and check what is the normal residual volume. Residual volume cannot be calculated by spirometry. Anything, any capacity of the lung which has, like total lung capacity, which has residual volume in it, cannot be calculated by the spirometer. So if there is no question on respiratory, on the lung volumes, mera jimmedari. One question invariably will be there from nephron physiology. Without that, there is no paper. Glomerulonephritis, sure. Vasculitis, sure. 500 topics you need to narrow down and bet on them in the last moment to do the revision, doctor. Yeah. So now, central chemoreceptors are most sensitive to partial pressure of carbon dioxide. Physiological dead space, we use Bohr equation. Maximum voluntary ventilation is 150 liters per minute. The air remaining in the lung after the normal expiration is called functional residual capacity. Boyle's law says pressure into volume is constant. Hypoxic pulmonary vasoconstriction. Typically, whenever hypoxia is there, systemic vessels undergo vasodilatation, whereas pulmonary vessels undergo vasoconstriction. That is the reverse. That's the reason pulmonary fibrosis, COPD, any condition that leads to alveolar hypoxia will lead to the development of the pulmonary vasoconstriction, leading to pulmonary hypertension, leading to right heart failure is what you need to basically remember. Once more, atrial fibrillation, atrial flutter, supraventricular tachyarrhythmias, ventricular tachycardia, first degree heart block, second degree heart block, usme Mobitz type 1, type 2, third degree heart block, indications for pacemaker. Invariably, one question will come, Dr. Oh, Italia, from the arrhythmias. There is no question paper without that. There is no question paper without myocardial infarction. You should know everything. Everything about myocardial infarction in the general medicine, right? So, now doctor. It is the ventricular distension that lead to Bajol-Jerisk reflex, which is the depressor reflex. Hormone responsible for BP regulation whenever there is any hypovolemic shock is antidiuretic hormone is what you need to remember. Whenever BP is very low, less than 40 millimeters of mercury, then CNS ischemic reflex will kick up. Capacitance vessels have less elastic tissue and less muscle. Cardiac output is increased by increased inotropic state of the heart. It is the isovolemic relaxation phase during which the coronary blood flow is maximum is what you need to remember. Of all the vessels, it is the capillaries where the blood flow is slowest. You should know what is Reynolds number, what is the importance of it. QRS complex means ventricular depolarization. P wave is atrial depolarization. SI unit of pressure is Pascal. Arterial baroreceptor activity is seen at systole, cardiac systole. Healthy adult may cardiac reserve will be almost 300 to 400% of that. What is meant by critical closing pressure? Pressure below which capillaries will close is called critical closing pressure. What is the normal velocity of the blood? 40 to 50 centimeters per second. The duration during which maximum contraction depends upon is called absolute refractory period. What is the temperature center in the hypothalamus, doctor? Preoptic nucleus is hypothalamus. So you should know very well. It is the posterior centers which control the shivering, anterior centers which lead to temperature loss. All the centers and the hypothalamic nuclei, what is their function? You need to be very sure about. Suprachiasmatic nucleus controls the circadian rhythm. So you need to be very, very sure about the hypothalamic nuclei, doctor. Now, stretch impulse is carried by 1A fibers. Once more, take it as my word, doctor. Golgi tendon reflex, right? Golgi tendon bodies. What are the mechanoreceptors? These are all favorite areas sitting in the examiner's question bank. Ruffney's end organs, Meissner's corpuscles, Pacinian corpuscles, right? And what is the nerve fiber classification, which is a myelinated fiber, which is unmyelinated fiber, which is the fastest fiber, slowest fiber, everything you should know for the tomorrow's exam. White fibers typically have less mitochondria. Tonic labyrinthine reflex, where will it get integrated? Medulla. Where is the writing reflex integrated? In the midbrain. Pepys circuit in the limbic system, which is involved with emotion, sexual drive, everything. It is the anterior nucleus of thalamus, which is related to Pepys circuit. Joint position, vibration sense are all carried by 1A fibers. Tonic neck reflex disappears by what age, doctor? 6 months. So whenever there is absence of loss of asymmetric tonic reflex by 9 months, it means there is a condition like cerebral palsy where there is an increased muscle tone. Whenever moderate cold is there, CMR1 receptor stimulates. The postganglionic parasympathetic fibers are cholinergic. The group B nerve fibers are sympathetic preganglionic fibers. Free nerve endings are the pain receptors. Sustained pressure is perceived by Ruffney's end organs. What is the normal cerebral blood flow, doctor? 750 ml per minute. What is withdrawal reflex? Withdrawal reflex is a flexion reflex, whereas Babinski is an extensor reflex, is what you should remember. Both CSF and plasma may bicarb concentration will be the same. Sweating is mediated by acetylcholine. Ventro-anterior thalamic nucleus. What is its function? You need to be very sure, right? So whenever basal ganglia is involved, basal ganglia lesions lead to echinacea, rigidity, tremor, extrapyramidal symptoms. They all can occur in ventro-anterior thalamic nuclei also. Now, all the nuclei, dentate nucleus, fastigial nucleus, cerebellum ka structure, you should know. What are the different lobes of cerebellum, you should know. Salivation of a dog when food is given along with the bell, Pavlov's, is a conditional reflex. There are 3 to 5 million cones in the retina. Orexigenic neurons, where are they located? Lateral hypothalamic area. 1 to 1.5 liters per minute is the renal blood flow. In the proximal tubule of the nephron, it is called workhorse of the nephron. So once more you should know, doctor, proximal tubule, distal convoluted tubule, collecting duct, ascending limb, descending limb, of loop of Henle, vasa recta, everything about nephron physiology. A proximal tubule होता ना, proximal tubule को कहते हैं workhorse of nephron. Glucose, amino acids, bicarbonate, everything get reabsorbed in the proximal convoluted tubule, almost 85% water reabsorption also. That's the reason it requires a lot of energy, ATPs, to do this reabsorption. That's the reason the mitochondria are so well developed in the proximal convoluted cells. Hence, proximal convoluted tubule of the kidney is called workhorse of the nephron, is what you need to basically remember. What is the best measure of GFR? Serum creatinine. What is the normal renal threshold for glucose? 200 milligram per deciliter. What is the cause of the hyperosmolality of the renal medulla? It is due to the potassium ion. What are the most important extracellular buffer? Extracellular में bicarbonate is most important buffer. Once more, NEETPG exam is not for 200 marks, only 199. Respiratory acidosis, metabolic acidosis, respiratory alkalosis, metabolic alkalosis, normal anion gap metabolic acidosis, high anion gap metabolic acidosis, renal tubular acidosis, Little syndrome, Dittleman syndrome, Gordon syndrome, Bartter syndrome. You should know these 10 to 12 conditions, 5 to 6 points अपने pocket में रखना, क्योंकि NEETPG is not for 200, it is only 199. One question आएगा, acid-base disturbances, renal tubular acidosis, or one of these little Dittleman, Bartter, etc. So please make a note. So by now, once 10,000 PYQs, once you go through, no doctor, आपको अवेयरनेस आएगा, आप ज्ञानी बनोगे, एक रिंग फॉर्म हो जाएगा, आपके लिए 3-4 शिष्यगण रहना है जो अभी अभी प्रिपरेशन शुरू किया, वो पूछेगा शंकर दादा, मुन्ना बॉय, क्या बोलोगे, क्या पढ़ना है लास्ट मोमेंट के लिए, राइट? So what will you tell them? Carcinoma cervix, endometrial carcinoma, ovarian carcinoma, bronchogenic carcinoma, pancreatic carcinoma, bone tumor, hepatocellular carcinoma, Wilms tumor, neuroblastoma, CLL, CML, ALL, hairy cell leukemia, Hodgkin's lymphoma, non-Hodgkin's lymphoma. अरे यार, काउंट कर सकते फिंगर्स के ऊपर, बोल सकते एग्जाम में क्या आने वाला है. Why, doctor? I was the topper of 2000 batch. This is 2024. 25 साल से देख रहे हैं. Medicine is the same, questions are the same, students are the same, but winners are different. That's all, right? So that's the reason. Focus, doctor. You don't need to read a lot. Once you finish 10,000 PYQ single liners, today only go to learnograph.com, download the Sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 10,000 PYQs made into single liners along with the topic is being given. Go through them. 50-60 hours is all the time you need to go through, but don't go through alone. You download by paying and share it to 4 or 5 friends freely. All you 4 or 5 form one study group, and then chalo yaar hum baithenge. If you are far away also no problem. You can open one Zoom meeting, sit, fat, revision karo milke, 4 or 5 students. PYQs ko. Then make a topic list and 500, 600 topics which you want to discuss together. 10 points about the topic. Bas. That's how you become winner. You don't become winner by joining plan A's, plan B's, plan C's. इधर रट्टा मारो, उधर बट्टी मारो, उधर जाके क्रैश कोर्स में जाओ, इधर एक नया टीचर आ गया दिल्ली से, उनका क्लास में बहुत ज्यादा भीड़ है, मैं भी जाके शामिल होऊंगा. That won't give you seat, doctor. What gives you seat is 4 or 5 good friends and the right material in your hand. Analysis of the PYQs is what you should know. Of course, you need. आपका सक्सेस किस में हाथ में है? पिक्चर का सक्सेस डॉक्टर मुरली भारद्वाज के हाथ में है. मैं आपके साथ रहूंगा एवरी डे, एटलीस्ट 1 आवर हम मिलेंगे और मिलके पढ़ाई करेंगे. सो डॉक्टर, hyperosmolarity of the renal medulla is due to potassium. From where are the sugars primarily absorbed? Jejunum, not ileum, not duodenum. Delta cells of the stomach secrete somatostatin. How will trypsinogen become trypsin? By removing few amino acids. Detergent action of the bile salts is because of their amphipathic nature. Of all the secretions coming from the gut, gastric juice has lowest pH. Daily salivary secretion, कितना saliva निकलेगा हमको? अगर सुंदरी को देखे या बंदरी को देखे हमारे रीडिंग रूम में 1000 to 1500 ml. Pancreatic juice rich in water and electrolytes is produced by secretin. whereas rich in enzymes is produced by cholecystokinin. So what are the cells which are called pacemaker cells, which will maintain the basic electric rhythm of peristalsis in the gut? Interstitial cells of kajol is what you need to remember. Heroine kajol ko remember, yaad rakho, interstitial cells of kajol. Now, inhibition of the mesenteric plexus results in decreased gut motility. Gastrin is produced by gastric antral cells, not pyloric cells. Secretion of the milk is due to prolactin. Ejection of the milk is due to the oxytocin. Then blood tissue barrier in testis. Which cells are responsible? It is not Leydig, it is the Sertoli cells, which are the supporting cells that maintain the blood tissue barrier, is what you need to remember. Why pre-ovulatory LH surge occur? By the time it is pre-ovulation, follicles have grown big enough that they produce a lot of estrogen. And there is a very low progesterone. That is a signal for the LH surge to occur, and that lead to ovulation. Which hormone increases with age? Parathormone. The more parathormone will lead to osteoporosis. Unit of prolactin level is 20 nanograms per ml. Deficiency of enzyme aromatase. Aromatase will convert the testosterone into estrogen. Deficiency of that will lead to deficiency of estrogen. After first meiotic division, the primary oocyte, it is arrested in diplotin stage. Whenever chronic atrophy of adrenal is there, that lead to decreased cortisol and addison. Thyroid hormone receptor, it causes the nuclear transcription after binding with P4. So what are all the hormones that act at the level of the nuclear transcription factor? Thyroid hormone, vitamin D, steroids, you should remember. Whenever you inject testosterone in a hypoandrogenic male, that will cause a decreased LH secretion. Action of the GH is mediated by, insulin-like growth factor 1 is anti-lipolysis. What is the half-life of T3? 1 day. Evans blue is used to measure the plasma volume. L-type is the most common type of the calcium channels of the skeletal muscle, is what you should remember. To record the electric flow in a voltage gated channel, what do you use? Patch clamp is used. Gap junctions are present in the cardiac muscles to transmit the impulse from one to other myocyte. What is the half-life of the albumin? 20 days. Half-life of prealbumin? 2 days. So in smooth muscle, you have calmodulin. Calmodulin activates the myosin phosphorylase. There is a myosin light chain kinase and muscle phosphorylase. Calmodulin activates muscle phosphorylase. What happens to the ghrelin levels? Ghrelin levels increase during starvation. So what is the blood supply of the liver? 50 to 60 ml per 100 grams per minute. Centri-acinar cells are present in pancreas. Acetylcholine muscarinic receptors are G protein coupled receptors. Then thyroid hormone binds to nuclear receptor. JAK-STAT kinase, the growth hormone acts on which receptor? JAK-STAT kinase. Cholecystokinin acts through inositol triphosphate and diacyl glycerol system, is what you need to basically remember. What is the normal serum osmolarity? 280 to 300 milliosmoles per kg. Sodium potassium 2 chloride, it contains 12 transmembrane spanning domains. RBC count in female is lower because they are regularly menstrual blood loss. Myosin has a ATPase activity. Ferritin normally is 100 to 200 nanogram per ml. It is 50 to 100 ml, which is the daily water loss in our sweat. The protein glycosylation occurs mainly in the endoplasmic reticulum and Golgi body. Type 1 alpha mutation in the EL alpha gene is a feature in maple syrup urine disease. Sirtuins are associated with metabolism. Phosphofructokinase enzyme require magnesium, carboxypeptidase required zinc is what you need to remember. The specificity of the enzymes is determined by the Michaelis constant. Lyase, decarboxyl is an example of lyase. Hexokinase is a transferase. It is the LDH2 which is predominant LDH in the normal healthy humans. Hydrolases belong to EC3 class according to IUB system. Trypsin is a serine protease. Fastest acting enzyme is catalase. Highest energy compound is creatine phosphate is what you should remember. Creatine phosphate provide 10.5 kilocalories per molecule. Now, atractylocyte, it acts as an inhibitor of oxidative phosphorylation. Thermogenin is a natural uncoupler which is available to uncouple and produce the energy from electron transport chain. Thyroxine, free fatty acids, thermogenin, they're all physiological uncouplers. Glucose is an aldose sugar. What is the effect of citrate? If citrate is there, phosphofructokinase 1 get inhibited. Hexokinase is inhibited by glucose 6-phosphate. How many ATPs in Krebs cycle? 24 ATPs. Right? So you need to look at the glucose molecule. If the pyruvate is the source of energy, how many ATPs? Citric acid cycle mein how many ATPs? Everything. Benedict's test, Fehling solution, glucose oxidase test, they all test the reducing sugar in urine. Cories is due to debranching enzyme defect. Fructose intolerance is due to aldolase B deficiency. Glucose transport in pancreas is by GLUT2 receptors. Insulin independent are GLUT2 receptors. Which GLUT receptors are insulin dependent, doctor? GLUT4 receptors. Whenever there is any starvation, then there is ketone bodies. Carnitine is very important for the transfer of fatty acids across the mitochondrial membrane. There is a carnitine transferase. Maximum cholesterol कहाँ रहता है? LDL में. Lipoprotein A is abnormal lipoprotein. Any abnormal levels of LPA is a risk factor for the atherosclerosis. Highest mobility among lipoproteins is there for high density lipoprotein, HDL. Apolipoprotein E is rich in which amino acid? Arginine. Chylomicrons mainly have B48, apoprotein B48. Primary hypercholesterolemia is type 2A is what you need to remember. Once more, take it as my word, doctor. Definitely in tomorrow's NEETPG. Familial hyperlipoproteinemia. Mixed hyperlipoproteinemia. Which lipoproteinemia is because of the lipoprotein lipase deficiency? Which lipoproteinemia can lead to milky white supernatant on centrifugation? Where do you see xanthelasmas? What are the various hypolipidemic drugs? Oh my God. What are the various lipoproteins? VLDL is the predominant carrier of triglyceride endogenously. Chylomicron is the predominant carrier of the exogenous triglycerides. Everything. What are the different types of lipoprotein lipase? What is the difference between them? Hepatic lipoprotein lipase and the lipoprotein lipase which is there in the vascular endothelium. You should know very well. So doctor, be ready for what examiner wants and deliver what he wants. You are the winner. So हम देखते देखते खेलते खेलते 310 high yield facts खत्म कर दिया doctor. So that is how last moment में you need to churn out the PYQs as a rapid reminders so that you are with a database and ready to attack the examiner. So once more, thank you for attending this wonderful session. Don't forget to like this video, write your comments underneath. Last moment, there is no last moment. If you think last moment, end of all the life, we can't win. We should think, okay, it's another day. Let us try. It is like a duty day in the emergency ward or casualty ward. With that spirit, you need to go to the exam. So thank you very much. Be peaceful. Nischinta, nischalata. Nischinta, no chinta. Nischalata, nothing. Very clear mind. निश्चिंता निश्चलता के साथ जो कदम आगे बढ़ाएगा वही जीत कर आएगा और सिकंदर बनेगा. Right? So thank you very much and we'll all see you tomorrow.